Hello, everyone. I know the COVID-19 vaccine is at the top of everyone's minds lately, which is why last week we started sharing regular email updates. But I also felt it was a good idea to use this week's vlog to talk to you about the COVID-19 immunization rollout and answer some common questions that you may have. Since the beginning of the year, we've made excellent progress in immunizing Albertans, with tens of thousands of people already receiving their first dose of the COVID-19 vaccine. This is all due to the many teams across AHS who have mobilized over recent weeks to provide immunization clinics to eligible staff and physicians, and have supported the immunization of residents in continuing care and designated supported living. This has been a huge, extraordinary effort by so many teams and people across the organization, and my thanks goes out to everyone involved. That includes the staff who made tens of thousands of individual calls to book immunization appointments. Our HealthLink team led bookings for Calgary and Edmonton zones, and public health teams took care of the North, Central, and South zones. And that's what I call teamwork. And along with our online booking tool, they continue to ensure people get booked to receive their immunization. Now with me today to talk more about the vaccination rollout are Dr. Laura McDougall, Senior Medical Officer of Health, Dr. Cheri Nijssen-Jordan, Vaccine Task Force Co-Lead, and Rod Kaliel, Executive Director for Workplace Health and Safety. So Laura, I'm going to start with you. Can you explain what went into deciding the phases of the vaccine delivery?
The whole question about who gets vaccine first is really important because, as we know, there's not enough supply available for everyone in Alberta to get vaccine at the same time. The issue of how to put people in sequence really comes back to a policy decision that's set by Alberta Health. And as Alberta Health was processing the issues behind the sequencing, key information that was available to them was recommendations that came from the Special Advisory Committee of all the Chief Medical Officers of Health across the country, the National Advisory Committee on Immunization, and all of the national groups were really recommending that provinces focus, in the first instance, on groups that are prone to the most severe outcomes and death from COVID, as well as the healthcare workers who are needed to really reduce the pressures on the healthcare system. So as Alberta Health was developing this phased approach, they were also looking at the ethical principles for being able to share scarce resources in a time of need as we have right now. And these ethical principles had been developed a long time ago for our pandemic planning for just this sort of eventuality. And the ethical principles that would have been considered in this decision were things like being able to maximize the benefit for people and minimizing harms, maximizing the benefit for all of society, and as we mentioned, sustainability of the healthcare system, as well as, of course, respect for people's autonomy and privacy. And the considerations really came back to how to protect the capacity of the healthcare system to be able to deal with patients with COVID and really continue to respond to all of the other pressures on the healthcare system because of this pandemic. So again, thinking about which groups of healthcare workers then would be in phase one or in this first group, they considered groups that would help to make sure that we're reducing acute care demand, making sure that we're protecting that critical workforce, and enhancing the flow of patients and residents through the system, as well as preventing COVID-19 outbreaks. So you'll notice that many of these factors are really linked together. The ability to minimize outbreaks, especially in long-term care and designated supportive living, contributes to minimizing, again, those harms on those groups that are most prone to severe outcomes at the same time, and that helps us to enhance the flow of patients and residents through our system and reduces the acute care demand. So back to the critical workforce then, to enable all of this, I think there's sometimes some confusion around how some of the decisions might have been made for the groups of healthcare workers that are in this very first phase. So phase 1A was intended to cover the first about 85,000 or so doses that would be available in Alberta from the end of December until the end of January. So again, if you think about the fact that there are about 28,000 residents in long-term care and designated supportive living, and about 36,000 workers who support residents in that environment, as well as the home care staff that also support continuing care, there's again even more limited numbers of vaccine available for healthcare workers beyond that. So the needs of the healthcare system to be able to keep delivering is what really drove the decision that in phase 1A, the staff and physicians in intensive care units and the respiratory therapists were the staff that were potentially really needed in that critical workforce to be able to keep the system going. In addition to this was staff in emergency departments, and as we mentioned, also in home care and long-term care. I think when we're thinking about this, there's a concern sometimes that people have, in a sense, that the whole workforce is so needed in order to keep the workforce and the healthcare system going. And there's absolutely no doubt about that. Every single one of the staff in Alberta Health Services, physicians and healthcare workers outside of Alberta Health Services are all vitally needed and important for keeping Albertans safe and keeping the system going. But again, looking then at how to sequence this, the decision was really on where were those pain points in the system that if there was a shortage of available staff, that it would really impair the ability of the healthcare system to deliver service. Phase 1 was intended to run until about the end of March. And Alberta Health is working right now on determining the list of people who will be included in phase 2. And that should be being announced sometime shortly.
I'm going to go to Rod next. And Rod, as we know, vaccine rollout is impacted by supply, demand, and capacity. We've done an incredible amount of work to increasing our capacity over the past few weeks, targeting anywhere from 8,000 to 10,000 vaccinations per day. And as supply ramps up, once it goes to sort of the general public, we know that we're going to be very dependent on community pharmacies to actually help deliver the larger doses of vaccinations per week. But within AHS right now, how are we working to get people vaccinated as quickly as we can?
Yes, thanks, Verna. Public Health has done an incredible job in setting up immunization clinics for workers 7 days a week since the vaccine arrived on December 15th. Clinics have been held during the day and into the evening. Once we had clearance to move the vaccine, Public Health immediately began taking it to long-term care and designated support living sites to immunize staff and residents. And in some areas, Public Health and Workplace Health and Safety have brought vaccine to acute care sites to target workers that are eligible. We are very fortunate to have an excellent HealthLink team that was able to mobilize and create a team to call eligible healthcare workers to book them for appointments. On January 4th, when Wave 1A launched, so did our online booking solution. This was created by a skilled information technology team that has allowed us to send over 65,000 emails to eligible workers to invite them to book their immunization appointment online. Our IT team has also created a method to text reminders to workers' cell phones who have not yet booked an appointment. And since the launch of the online booking tool, our HealthLink team continues to support the effort by booking second dose appointments, contacting workers who do not have email access, and using auto dialer technology to offer a number to call if the worker needs assistance in booking their appointment.
So my understanding is that since we actually opened the online booking tool, which is on January the 4th, if I'm correct, we've sent out more than 60,000 emails. And I think we have over 25,000 appointments booked. So that's really, really positive, but we want it to be more. So not to preempt, I'm going to go to Cheri next to tell us a bit more about how the COVID-19 online immunization booking tool works and who is eligible to sign up.
So Rod has provided some information about the online booking tool, but I'll just add a few more details. So the reason that it was brought on was because we wanted a very efficient way to actually reach a large volume of people, both healthcare providers as well as the public, that will allow them to book their appointments in an easy fashion. So the important thing, especially from the healthcare worker side, was for them to update their information and make sure that it was available for us to provide that to the online booking people. With the definition of the groups that Laura has already identified, we then went to operations, medical affairs, long-term care facilities, the home care areas, and regulators to try and get a list of those available healthcare workers and individuals that would be part of this rollout. With the online booking, the names were validated by the staff and subsequently went into the online booking system where they would load it in and send out these emails in batches. That meant that those 60,000 went out over a period of time. They didn't all go out at once. They went out in batches that then people would have that opportunity to respond. It would come into their preferred email, and in that email would have a link which they could click on to book their appointment. And from there, they were able to work through the screening information related to symptoms and where they worked, and ensuring that they again validated that they were from those areas that were designated groups. And then subsequently, they were able to book both their first and second appointments. And they would get those sent back to them in an email. So they then could work towards making sure that they were incorporated and going to those appointments on their days off, or hopefully making sure that we're not getting all of our healthcare workers all done at the same time, putting our system at risk by not having those people in the system. So, subsequent to that, there has been reminders sent to a lot of the people that have not opened their emails, and those reminders including, text messages, additional emails, and there is also an auto dialer component so essentially we have 4 reminders for people to actually make sure that they are booking. And we've seen a big increase in the number of people that have been booking since we've added the reminders. If people have difficulty working with the online booking, then they've been encouraged to follow up with HealthLink, and that amazing team has been doing follow-up on a lot of these bookings and helping both healthcare workers as well as the long-term care staff to provide those bookings as necessary. I've had really good feedback. I got an email from a physician just the other day that said this system is very slick, and in general, we've had really good feedback on that booking system.
I also want to just highlight that, the online booking tool, shout out for that team. You can hear from what Cheri just said, the complexity of all the different variables that they have to take into consideration. And right now, the booking tool is actually designed to match appointments to vaccine supply. So as soon as supply runs out of the clinic, appointments will stop showing. But that is predicated on knowing that the supplies are going to arrive on time. And so I just want to forewarn everyone that cancellations could happen if the shipments don't get to us on the date that we anticipate. And just be assured that cancellations are the last resort. We don't want to have cancellations, but unfortunately, we're not in control of the shipment and the arrival date. So I'm going to go to Rod next to talk about the actual immunization clinic. And Rod, what can people expect when they actually arrive at the clinic?
Yeah, one thing that we're asking all workers to do before they attend the appointment is to complete their daily Fit for Work screen online. In the same way that they do this for their work shift, the worker will be expected to present proof of fitness to work before they enter the clinic. Now, each clinic is going to be set up slightly differently, but in general, you can expect a hand sanitizer station to be there when you enter the clinic. Please thoroughly clean your hands before you approach the administrative desk. Then you'll be offered a fresh procedure mask to don, Please doff your personal mask and don the mask provided. Then the administrative professional will ask for your identification to verify your appointment. From there, you may be asked to proceed to a staging area or directly to an immunization station. Once you are at the immunization station, your immunizer will go through the Fit to Immunize questionnaire to ensure that you have no contraindication to being immunized. If there are no contraindications, they'll administer the immunization and ask you to proceed to a waiting area to stay for 15 minutes to ensure there's no adverse reactions to the immunization. All immunizations will be recorded in Meditech, the public health system. Workplace health and safety will also be asking workers to self-report their immunization after their second dose to record it in your employee health file in MySafetyNet. So we've put posters on site for workers to scan a QR code to allow them to self-report. Alternatively, workers can find their self-reporting portal on Insight.
Laura, I'm going to come to you with the next question. So last week, there was some misinformation that was circulating about vaccine wastage. So can you maybe educate us a bit about what's been happening with vaccine wastage and how has the team been working on trying to reduce that and keeping it as a minimum?
So first of all, every immunization program has some degree of inadvertent vaccine wastage due to issues like refrigeration problems, broken vials, any other issues in vaccine handling, appointment no-shows. So Alberta Health Services has developed a vaccine wastage minimization strategy. And really the purpose of this is twofold. First of all, to minimize the number of vaccine doses that are wasted to the extent possible. And then also to make sure that we're maintaining alignment with that sequencing that we spoke about earlier. We have very experienced handlers and public health immunizers who help make sure that we are doing everything we possibly can. And this really starts with making sure that we are maintaining adherence to the cold chain. So that's paying really close attention to ensuring that the vaccine stays at the recommended temperatures throughout its whole journey. And then making sure that we're really following all of the handling requirements that have been dictated by the manufacturers of the vaccine. The public health team will also make sure that they only thaw and prepare the number of vials that are required in order to meet the demand for the clinic that day. And they really optimize the number of people who are booked and then the management of vials around that. To make sure that we have enough people to immunize with each open vial, we've also been overbooking all of our clinics by about 1% and helping to make sure that we have people on standby in case there is any vaccine left in the vials at the end of the clinic period. And then as a very last resort, if there were any vials or any doses left at the end of the day, the immunizing staff would then randomly select between that team any vaccine to go to the immunizers themselves, or if there weren't any immunizers who were still needing a vaccine, then to look at other healthcare workers who are around. But all of these other strategies that have been put in place with the experience that we've gained over the last few weeks have made that a very rare happening. So the wastage is extremely, extremely low.
Cheri, we're going to come to you next because I think one of the questions people have is about the second vaccination, how long they have to wait, and how are we ensuring that they get it in time?
Yes, this is one of the questions that we get a lot of commentary on. So there have been some variations and changes within the guidance since the vaccines first came out. At the moment, most recent information that we have is that all long-term care and DSL residents need to receive their second dose between 21 and 28 days. It's not fixed on one day, there is a range. And so it's important for people to realize that you don't actually have to have your dose on a particular day, there is a range. So the healthcare workers and the remainder of the population is advised that they need to receive it up to 42 days. So that means we've kind of put into the online booking that somewhere between 35 and 42, you would be offered those second doses. So that's how you will find out when you book your first dose, you actually book your second dose, and the window that you're provided for choosing that second dose is in that 35 to 42 days. So when you actually complete your booking, you have both of those appointments available. You'll get an email confirming that, and then you can actually add it to your calendar. The other way that we're booking the second appointments is there are some individuals that got their phone calls with HealthLink, for example, at the beginning. They can then follow up with HealthLink to get their second appointments booked at the moment. And then ultimately, we will have some opportunity to go in and actually book your second appointment in the online booking tool. So things are evolving, but basically the dates are for healthcare providers and other populations other than long-term care. It's the 30 up to 42 days. So we don't need to specifically worry about 21, 22 or specific days. The other thing is that if you do run into trouble and you're just not sure, you certainly can contact HealthLink to have that information. They can help you book that second appointment online, and then you can get confirmation of that dose.
Great, thanks very much. And thanks to all three of you for coming on the blog today. I really want to express our appreciation for everybody who's been working on the immunization rollout, because we know how important it is to our pandemic response and protecting the health of Albertans and each other. And our people all across the province have really stepped up in a big way, as they always do. We've also received hundreds of expressions of interest from a variety of healthcare professionals who want to assist with vaccination. So thanks for that. And thanks to all of you. We're working to fill all the positions we need to immunize Albertans as quickly as possible against COVID-19. And this is yet another example of the continued dedication of all of you and how you inspire us every day. For more information on COVID-19 immunization, please keep an eye out for our regular email updates or visit the COVID-19 vaccine page on the AHS website. And remember, if you are scheduled to get your vaccination, please ensure you make that appointment. So thank you for everything that you do. We could not do any of this without you, and we'll talk again next week.
Together, we do amazing things every day.